In the case of doctors, for example, one of the things I hear a lot about when I hear health discussed, or healthcare even, is when we could be solving things like acute blockages in health systems by allowing people to be cared for at home or using technology. Elderly people, for example, low blood sugar means they're likely to fall more. Maybe devices could help alert when something like that's going to happen. Are there any societies in the world that have kind of got a lead on this, or are we still in this jumble of dealing with administrative chaos when it comes to healthcare?
Right. It's interesting. You don't see it uniformly. You see different versions of it. So let's just talk about the pure technology for a second. There is a concept called the hospital at home, which is basically the idea that you can provide all the care that is typically provided in a normal hospital acute bed, not a monitored bed, not an ICU or a monitored bed, but a normal bed at home. And the fact of the matter is that technology has been available for 20 years, and there have been peer-reviewed published articles since late 80s showing that you can safely take care of people at home with the existing technology. The reason for the adoption has largely been the medical delivery system and the payment systems don't exist to support that model. And so you've got the ability to move care out in some ways is way ahead of our ability to absorb that sort of thing. But I do think that you're making a really important point, which is long term, the trend is to try to figure out how to make healthcare location independent. And that is being accelerated by miniaturization, by digital platforms that allow transactions and interactions amongst people wherever they are. So mobility and mobile technologies makes it possible for doctors and patients to interact in any location. The ability to basically build a delivery system that can work is a challenge. So you go to Netherlands, it's a really nice advanced primary care system that's home-based, but virtually no equivalent for specialty care. So if you go there, hospitals are all occupied, big problem in the emergency room. Why? Because if you need primary care services, a primary care physician will come to your home. You need a specialist, you have to sit in a hospital bed because they haven't built a specialty care system to accommodate it. So great, but not at all complete, right? No one would want to model the whole system, but it definitely shows what's possible if you focus on that area. So I would say that every country in the world has examples of things that they have that are good learning for other countries, but you can't go to one country and say they have it right. And one of the things that I often share with people, because I've been fortunate enough to see healthcare up close in in a dozen countries. Every single country, if you talk to their policy people, their belief is that if they could just change the economic model that they operate under, their system will be better. And they all describe economic models that other countries will say to you, if I could just change from this economic model to another one, I'd be better. And you see this fascinating circumstance where everybody thinks that everybody else's model is ideal, and it's a circle. And that tells me that it's probably bigger than just what the economic model is. There's probably more, there are some factors that have to do with how medicine is practiced, which is the same, really the medical tradition is the same in all Western countries, that underpin some of this, as well as these disruptions like technology, which will change all of these societies at the same time.
In Ireland, we have debates day in, day out. You just turn on the radio every day, there's something on the radio about our healthcare system and how bad it is or whatever. One of the things we hear a lot about is bureaucracy, and other things we hear about is overspending. In terms of your views on how the Irish healthcare system is functioning, to the man on the street, we consider it a basket case. But maybe to experts like you, maybe it would seem like as similar as any other health system under the circumstances. How would you sum up the Irish healthcare system?
Every country thinks their system is worse than every other country, so that's normal. I would say that the Irish healthcare system looks very typical of other Commonwealth healthcare systems. It's based on the same traditions. Its funding models are pretty typical. There's not any evidence that the general quality of care, as measured by social indicators, is a wild outlier. There's a wide range. When you start looking at indexes of health, you realize that any given country is really high on some and really low on others, and you have this sort of wide spectrum of variation. I think the one thing that is probably notable in Ireland compared to other Commonwealth countries is a historically relatively modest level of investment in healthcare information technology relative to the wealth of the country and per capita income. And that is oftentimes driven by context, right? And Ireland has had a longer recession than the US, the UK, or Australia as a point of comparison. And in that case, there's less public monies to be made available as part of an investment. And I think that most people would say healthcare leaders in Ireland have great visibility to healthcare in the rest of the world. And I think that they would say the one difference is a generally less investment over time than others. And the challenge is that to go from our current state to a future state that might be more effective and more productive, some investment needs to be made to get over the hump. You can't get to a more cost-effective state by going downhill. You have to go uphill first. And it's the capacity to make the initial investments, to create information for analytic purposes, to lay foundation for digital interactions. Those kind of things have to occur, and then you'll be able to recognize the value on the other side. Looking
to the future, you know, we see the world's population is only going to increase. Huge gaps emerging between rich and poor. If you'd asked me 8 years ago, will we ever approach a nirvana where we'd have some wonderful health system in every country in the world, I might have been optimistic. Now I'm pessimistic about that. I mean, what are your views on the future and where, you know, the world is going in terms of healthcare and health technology?
Well, I'm optimistic on a couple of dimensions because, first of all, a large part of what drives public health and health status is really scientific innovation. And scientific innovation continues to march on. And there are a number of dismal conditions that we suffer from that we're on the cusp of figuring out things that will either remediate those diseases or treat them. For example, we've done a lot to really reduce the death rates associated with heart disease worldwide. And what you're seeing right now is while heart disease is present worldwide, as a cause of death is dropping rapidly. And what's emerging is cancers. So we give people the opportunity to live long enough to get another disease of aging. And but there's a lot of innovation going on around cancers, and there will be more of those innovations going on. Same thing with neurologic diseases, dementia like Alzheimer's. And so you can't underestimate the effect of science. The challenge with science is, it turns out, this is sort of an odd thing to say, but the least expensive type of medical care, or the least expensive outcome for a society, is no treatment and death. People say that death is the cheapest form of health care that exists. What actually happens is as societies figure out how to treat people, costs go up. And if you can treat people and not cure them, that's the most expensive. If you can cure them, that's the least expensive. So the cheapest is nothing. The most expensive is treatment without cure, and in between is cure. Now, we want to do something, and we want to do something about illness, right? So by its very nature, healthcare costs have to go up because we're taking non-consumption and converting it to consumption. The goal is we want to move it toward cure, and I think that presses on. The healthcare delivery system itself sits underneath all of this, and it is really where the conversation that you ask lives. And when people talk about optimism or pessimism around healthcare, oftentimes they're describing really more the delivery system's efficiency. I would say the following: the trends around personalization and digitization are so powerful that they're going to transform the healthcare system with or without the willing cooperation of the current owners of the system. Because individuals will simply not stand for not being in control of their destiny, and they won't allow healthcare to treat them differently than other parts of society treat them. And the technologies that are available make things possible today that were never possible before. So you don't need a doctor and a patient to be in the same room anymore for many things. Our model is based on physical proximity, but you don't need it. The minute you realize that you can separate them, you have a totally different relationship between supply and demand, between access to experts, the ability for one patient to see many doctors at the same time, things that were completely impossible because the cost of physical convening created a barrier. And that concept is very profound and is going to find its way into the healthcare system and change the rules in a way that right now the participants are not even thinking about as deeply as they will in the next, say, half decade or decade.